For the neurological assessment, first we would just do overall like mental status, so your name,
Sherry,
and your date of birth.
3/13/68.
Okay. And then just their facial expressions and overall posture and their speech, just making sure that's good. And then we'll do the olfactory, which is cranial nerve 1, and that's just the sense of smell. So we would have them like hold one nostril and then we'd put something in front of them just to see if that's working. And then 2, we would do cranial nerve 2, which is optic, and that's vision. So we'd look in and like under the pupil and around the pupil. And then 3 is the ocular motor. So I'm going to have you open your eyelids. And then I would just look in the eyelids too. And then cranial nerve 4, which is the trochlear nerve. That would just be downward eye and then upward. Just making sure that's intact too. And then cranial nerve 5 is the trigeminal nerve. So I'm going to have you open and close your mouth. So that's the motor function. And then the sensory function would be, I'd do light or dull and just have them tell me which one it is to make sure that's intact too. And then cranial nerve 6 is the abducens nerve, and that's lateral eye movement. And then cranial nerve 7 is the facial, so smile, frown, and puff out your cheeks. And then we're just making sure that's intact too. And then cranial nerve 8 is acoustic, so when we're doing it, we could just see if they're hearing everything that we're saying and they're not saying what to questions. Or you could just close one earlobe and just say something, whisper something, and see if they say it back. And then cranial nerve 9 is the glossopharyngeal nerve, and just swallow. And so we're making sure that's intact. And then cranial nerve 10 is the vagus, and then that's talking. And so 9 would be the gag reflex, and then 10 would be talking and swallowing. And then cranial nerve 11 is the spinal accessory, so we'll just have them shrug their shoulders and then turn your head. And so we're making sure that's good too. And then cranial nerve 12 is the hypoglossal, so stick out your tongue and just move it side to side. So that's good too. And then cerebral function, we're checking balance, gait, and then we're doing the finger to nose test. So touch my finger and then touch your nose and then touch my finger again. So we're making sure that's good too. And then we are also doing the grassophasia test. So I'm going to take your hand and I'm going to write a number. What number did I write?
6.
Yeah, so that's good. And then the deep tendon muscles or deep tendon reflexes include the biceps, triceps, and axials. And then there's tests for the plantar test. And then we're just making sure everything's intact.